Anthrax is a zoonotic infection, which simply means it is gotten from animals, mainly goats, sheep, and cattle. So please don't run away from your family members. Anthrax cannot be transmitted from human to human. It can only be transmitted from animals or animal products to humans. The culprit responsible for this infection is a bacteria called Bacillus anthracis. A person gets infected when he or she comes in contact with an infected animal or animal products like wool, hair, or skin, popularly known as pomo in Nigeria. There are 3 types of anthrax depending on how it is gotten. The anthrax gotten via inhalation is called inhalational anthrax. The anthrax gotten via entry through the skin is called cutaneous anthrax. The anthrax gotten when you ingest a substance contaminated by the bacteria is called gastrointestinal anthrax. Of all 3 types, the most common type is cutaneous anthrax, which accounts for about 95% of all cases of anthrax. The symptoms typically begin days after exposure and are specific to the type of anthrax. In cutaneous anthrax, the patient typically presents with a skin lesion, which begins as a purple, which may be itchy, and enlarges within 24 to 48 hours to form a fluid-filled cavity called a vesicle. Then it becomes an ulcer, which is usually painless but can be itchy. Within 7 to 10 days, the ulcer develops into a black eschar, which lasts for another 7 to 10 days before leaving behind a scar. In intestinal anthrax, the symptoms begin 2 to 5 days after ingesting the contaminated substance and are non-specific to a particular disease. These include abdominal pain, fever, nausea, vomiting, malaise, anorexia, hematemesis, which is simply vomiting of blood, and diarrhea. Inhalational anthrax is rare, and when present, a case of bioterrorism should be suspected. The immediate presentation could be with a non-specific flu-like symptoms, which could include a sore throat, mild fever, fatigue, and muscle aches. Then the following symptoms may ensue, which include mild chest discomfort, shortness of breath, nausea, coughing up of blood, which is called hemoptysis, painful swallowing, high-grade fever, and shock. The major way to prevent this disease is to avoid getting in contact with animals and animal products in places where anthrax has been recorded. Also, avoid eating meat that hasn't been properly cooked. The prognosis of anthrax also depends on the type of anthrax. Most cases of anthrax are the cutaneous types, which are mild and resolves without treatment. However, other forms of anthrax are potentially fatal, with inhalational anthrax carrying the worst prognosis. With early commencement of treatment, the mortality can be as low as 1%, but with delay in treatment, the mortality for gastrointestinal anthrax and inhalational anthrax can be as high as 40% and 45% respectively.